when I came in here, it struck me, it was like a medical device sales meeting, maybe with the difference that we dance in the evening. The other thing that struck me is that I'm probably representing a minority here, and I think it's a very good opportunity to have a dialogue like this. So I've been 20 years with Johnson & Johnson, mainly in the Western European markets, coming out from Sweden. And over the last 10 years, I've been leading our organizations in the what we call emerging markets, meaning Russia, Central Eastern Europe, Middle East, and Africa. And that's a slightly different thing, I must say. A few words about J&J. We are one of the absolutely largest and most diversified healthcare companies. We've been around for 125 years, and I think there's many people, mothers and fathers, who know the trust mark of J&J when you dealt with your babies. We are organized in 3 different sectors, pharmaceutical, consumer, and the one I'm acting in, which is medical devices. That's a company within J&J, the largest, biggest medical device company, where we, just to understand it, we normally in a hospital on an everyday basis have 15 different representatives who goes in and interact with those healthcare practitioners that Serge talked about. So we are a very wide and broad company. What holds a company together like this, and has been doing so for the last 65 years, is a paper which was written by Robert Wood Johnson in the late 40s, where he stated our responsibility in a value statement which talks about the responsibility vis-à-vis our customers and patients and doctors and mothers and fathers, our responsibility vis-à-vis our employees, our responsibility vis-à-vis the community we serve in, and ultimately, if we do this well, we should return a shared profit to our shareholders. So that keeps us together. We are very, very much committed, and I would say we are a value-based driven company and have a very strong culture of trust and respect. And this is very much has the foundation in the credo I just talked about. And everything we do needs to be of a mutual trust between J&J and our stakeholders, and they are many those days. And that's why we as Johnson & Johnson constantly remind ourselves that we need to have a passion for integrity and understand that our actions, whatever we do, has far-reaching consequences. And what we put it as everyday actions create our future. I talked a little bit about the stakeholders we deal with, and if you think about the challenge that healthcare is facing, there is a shortage in resources for delivering healthcare in the future. There is definitely not a shortage in demand. And we believe that the industry and companies like us has a place to play there, whether it's the products we bring, whether it's the new services we bring in to make healthcare being something everyone can access. That means that 20 years ago when I was a rep, it was fairly easy. I talked to a doctor and I talked to a nurse and I delivered my product and I walked out there. Today, I talk to governments, I talk to policy regulators in those buildings, I talk to patient organizations, and I talk to a number of different stakeholders. So we need to have some guidelines to address this. And we have, but sometimes we get it wrong. We clearly did a few years ago. Which was a critical wake-up call for a company like J&J. Was obviously, we can regret what we did, and we did. We paid our price. But for us, it's to learn from those mistakes we did and work for a better future, to regain the trust, the respect, and the reputation we need to have to go on. So we have very, very diligently worked with our Passion for Integrity campaign. And some of the speakers talked about this in the beginning, and I would be 100% in agreement that this starts and ends with leadership. It's all about leadership. And it's not about just talking about what the leadership is. It's actually about walking the talk, as we say. You really need to show that. So we build that into everything we do. But we also invested a lot of dollars into this. We invested in roughly 100 people around Europe who are so-called healthcare compliance associates, who helps us with training, who helps us to engage with the trade association, who helps us to live those processes we state and that we're supposed to live in. We also spend a lot of time in engaging ourselves with the trade associations. We demand from our leaders that they sit in those boards across, in my case, the emerging markets and across EMEA. I personally sit on Sergio's board and work very, very closely with many of his associates to shape that environment and to drive those guidelines and agree around those code of conduct in how we do this. We also engage ourselves in meeting with different government bodies and see, can we agree on how we interact with your stakeholders in a proper way? And finally, as most companies do, is that we try to measure if what we do makes an impact. So we have internal surveys, or mainly what we call the Credo service, where we talk about how we respond to those responsibilities. So we let our employees rate us on that. We have internal audits, and we have third-party audits who comes in and looks to, are we having a compliant and ethics behavior? And finally, and I think that's what it ends with, we look into what the reputation says about J&J, and if we are allowed to come into those discussions with the different stakeholders. So hopefully, we are able to be the most respected medical company in the world by 2020. Thank you very much.